हेलो, एक बार टेस्ट कर लेंगे। हाँ, आवाज आ रही, क्लियर है, फोटो है, ये है वो है।
हाँ, टेस्ट कर लो नीरज। You want to try? You want to share your screen? Good afternoon नीरज and welcome.
मैम आपको क्लियर आ रही है आवाज?
हाँ, मुझे बहुत क्लियर आ रही है, कोई प्रॉब्लम नहीं।
स्लाइड को आई एम नॉट वेरी वेल अवेयर ऑफ हाउ टू प्ले माय स्लाइड्स मैम।
I'll just tell you. Your PPT is there on the screen, right? On the desktop. You have
One
to
second,
open it. Yeah, open your PPT and minimize it.
1 second ma'am.
Yeah. Meena, Lokesh, come here. Sir is adjusting.
That also has to be shared.
I shared that. Now, sir, Sir wants to share his PPT. Just tell sir how it is to be done.
Sir, there will be an option like.
Let me open it first.
Yeah, open it.
Yes.
हॅलो, हा ईश्वर. हा, नाही जरूर नाही आहे. तुम्ही तिथे फक्त रूमचा फोटो घेऊन या आणि स्क्रीन वरती सेमिनार रूम मध्ये थोड्या वेळाने केला तरी चालेल. ओके. हा, गॅलरी हॉल मध्ये पीजीज आहेत, तिथे एक फोटो घेऊन या केव्हा पण. ओके, 2:30ला तर सुरू होईल, 3 पर्यंत तरी येऊन फोटो घ्या. ओके, स्क्रीनचा पण घ्या आणि हे पण घ्या तुम्ही. नीरज आणि म्हणाली दिस आहे. नीरज तनेजा आणि म्हणालेली इकडे अजून सुरू नाही झालं. यू कॅन जस्ट से हाय ऑन फॉरेन्सिक बाईट मार्क्स पर्स्पेक्टिव्स. You can just say hi.
Good afternoon, sir.
Hi, Neeraj. How are you?
I am good, sir. Long time.
Yeah. अभी हमारे बच्चों को सिखाने वाले हो क्या?
Yes, sir.
Good.
मैम से ही सीखा है सर.
नहीं, मैम भी सुनने वाली है आपको ही. मैम ही सीखे.
मैम आपको मैंने पहले भी एक बार शायद बताया था, 3rd ईयर में था, आप लोग पीजी कर रहे थे, आप और अंजना मैम. तब ये वर्ड आया था फोरेंसिक डेंटिस्ट्री मेरे सामने. देन आपने, आई डोंट रिमेम्बर, अंजना मैम ने मुझे जीडा का एक आर्टिकल दिया था जिसमें फोरेंसिक का वो पूरा था, मतलब एक आर्टिकल था. So after that I developed interest in that. I still have that journal with me. वो छोटी सी कॉपी है. So all the forensic dentistry all started from there, ma'am.
Good.
The PG room of KLE Dental College Oral Medicine PG room.
Oh, very good. So nice. But we really, you are doing great job in forensic. So we all are actually looking forward to listening and hearing you now.
Sure, ma'am.
Yeah.
Chalo, I have to go. I will take your leave.
Right, sir.
Yeah, we'll meet sometimes.
Sure, sir. Sure.
Yeah. Okay. Bye.
Yeah, ma'am. It's on the laptop, ma'am.
It's on the laptop, na? अभी वो minimize करो, and on this you can screen sharing होता है ना?
There will be a pop-up from down.
हाँ.
Present now. Is it like that?
Yeah, see, you can see that present now option on the right side.
Yeah, it's there.
So when you click on that, you will get as share window way. You have to share your window.
PowerPoint window.
Okay.
PowerPoint window.
Select that window.
Okay.
You select that window, PowerPoint with.
Yeah, ma'am, I'll just do it.
Yeah, do it. Take your time. He does now. Let it be like this. He will put that in that slide, and because it will be confusing, let Zamira ma'am introduce him like that. Let him start presenting his thing. We all will mute ourselves. Only Zamira ma'am's video will be on. She'll introduce him, and then. हाँ. पर अभी दोबारा उनको करने के लिए नहीं करेंगे. If you see now, I can start sharing.
Yeah, ma'am, I got it.
What we'll do is, now we will initially, we will share 3 of our slides. Okay.
Right, ma'am.
Some will be our Ranjan week ka, then your that flyer when we are introducing you, that will be shared on the screen. After that,
Right.
we will say that we hand over the screen to you, sir, and then you can start
Right,
with
ma'am.
your screen sharing. So only your
Right.
video and your screen will be on. Rest all will mute themselves and the videos also will be off. Okay.
Right, ma'am.
Then
That's
again,
fine.
once your presentation is done, we will stop.
Yeah,
you
ma'am, it's
stop
done.
sharing.
It has around it's small slides. I mean, 50,
No,
60
no.
slides,
No,
but
no,
very
you
easy.
can,
It will be done before 1 hour.
no, you can take your time. That is not the issue. Once you finish your presentation, you stop sharing your screen so that we want to project the certificate. So we will start sharing our screen after that. Once the
Okay,
presentation
now
is
I'll
completely
just
done, we'll let you.
try sharing once and then I'll stop.
Okay, fine. Okay, yes. Yes.
Right.
Yes. Good, very good. Excellent. Okay. I think we'll start
Stopping
with
it.
this session. Yeah, it's showing very clearly. No issues. Okay. I'll tell.
Right, ma'am.
I
Right.
think we'll start with the session. Go on, start.
It's okay, I stopped it.
No, now you have stopped it. Okay.
Yeah.
Even if you want, I feel you can start with that also is okay. You can just
No,
project
no,
your.
fine. I'll do it that time.
Okay. Okay, fine. No problem.
Ma'am, there as well as PG students, right, ma'am?
Yes, you tell me. Neeraj?
Ma'am, they are UG and PG students, no?
Yes. UGPG students. Yeah.
Right.
Yeah.
I, Dr. Namrata Patil, welcome you all for the last session of ninth Ranjan Week celebration. Today we have with us Dr. Neeraj Taneja. So I request Dr. Zamira Nayak, Professor of Oral Medicine and Radiology Department, KLVK IDS, to introduce.
Thank you, Namrata. I'm very happy to introduce my batchmate, my own batchmate, BDS batchmate, Dr. Neeraj Taneja. And I think it's a proud moment for After his graduation from KLVK IDS in the year 1998, Dr. Neeraj Taneja pursued post-graduation in oral medicine and radiology from SDM Dental College, Dharwad, postgraduate diploma in forensic sciences and MBA from Punjabi University, Patiala, and currently is pursuing his PhD OTS University, Greater Noida. His areas of interest include forensic odontology, orofacial pain, and oral cancer. He has more than 25 publications and more than 50 and has been a guest speaker at various national and international conferences. Adding some more feathers to his cap, he was also conferred with fellowship in forensic odontologist. Has also received Excellence in Forensic Odontology Award by IHPA, Indian Health Professional Association, and was conferred upon the Promising Dental Leadership Award in 2000. Talents of Healthcare. He had organized 14th National IFO Conference and 6th World Conference in Forensic Odontology, this revealing his interest in forensic odontology. With this brief introduction and wishing him great success in future too. Thank you. Dr. Neeraj, you can start sharing and start with the presentation.
Thank you, Dr. Zamira. Thank you.
Yes.
You can see the screen, slides, visible to all?
Can see.
Yes, Neeraj. It's really good. Yes.
First of all, I would like to thank Vishali ma'am, Anjana ma'am, and respected Kale ma'am for giving me this opportunity to present my interest topic, bite marks, in my alumni college. And thank you, Zamira, for a nice introduction. So, coming to the topic, bite marks. You all must have heard of this topic quite oftenly, especially when you are in KLE and other colleges. Now, it has been it's a beautiful science and helps in law, basically. But nowadays the questions have arisen on this science. So the main topic of today is what are the perspective and what are the main challenges. So as there are so many undergraduate students, so I've included a few basic about bite marks. So I'll start from that. The basic main role of forensic odontology is by providing necessary information regarding bite marks. This is to collaborate with other. I would like to highlight this point, evidence, to collaborate with other evidence available at crime scene. Why now the questions are being asked to forensic odontology and on the bite marks evaluation and analysis? This is just a science to collaborate the other evidence. People have been convicted based on this science. So that's why those people now are being released from prison, because this is the science which is to collaborate the other evidence. Not only solely on the basis of this, there should be a conviction. The other challenge mainly nowadays, especially India is concerned, is awareness among the law agencies, especially police, is very, very minimal. This is the irony now of this present system. Rarely any of the district in India out of 750 plus districts has a forensic odontology on government roll. So what they do is, whenever they need, they take some private help, and most probably they don't want this evidence, but at few cases they have been taken into consideration, especially the Nirbhaya case. This bite mark evidence was quite evident and highlighted in that case. Thank you, Kelly, for giving me this opportunity. Topic is perspective and challenges. Criminal may lie through his teeth, through the teeth themselves cannot lie, though the teeth themselves don't lie. This is the bite mark. And as we know, the basic principle is just like two fingerprints, no two mouths are alike. This is a hardcore fact. The intention is to raise awareness about the testification of bite marks in court of law and to have a minimum requirement for recording and preserving the bite marks. Bite mark evidence. What is its relevance? The relevance is to assist the judicial system about the people's interaction at the scene of crime. Second is to individualize due to their unique dentition pattern. And third is to play a crucial role in rape and child abuse cases. And the last one is to describe the level of violence of crime. Now, when we do different types of bite marks, we'll understand what do I mean by describing the violence level of crime. These are the four main parts which are resolved with the help of bite mark evidence. The definition, McDonald defined it as marks caused by teeth either alone or in combination with other mouth parts. Whereas ABFO defined it as a physical alteration or representative pattern recorded in a medium caused by the contact of teeth of human or animal. So ABFO has included both human as well as animal. There are three different types of bite marks which are, in a layman language, I mean to say, clear, obvious, noticeable. The pictures are there. Now, when you look at noticeable, here you can easily notify there is a pattern of injury depicting bite marks. So this type of injury, when you see, this shows the level of the mental status of the accused person which is causing this bite marks, how much pressure it has created, what is his mental state. So this shows the level of crime. So coming to the classification, there are different types of classification based on manner of causes. That is non-criminal, could be love bites, or criminal. In criminal, it could be offensive upon by assailant himself or upon assailant by victim. Defensive, like when the victim put a marks on the accused or assailant. Other type of class, the offenses is normally is well-defined pattern, usually singular pattern associated with arousal and most often post-mortem. Defensive is not well-defined because you are protecting yourself. In defense, the victim is creating the bite marks. It will not be well-defined. There will be multi-bite mark patterns. There will be defense against the assault. There will be repeated bite marks. So this way you can differentiate which is offensive and which is defensive. Gustafsson in 1996 gave one clinical classification, that is sadistic or sexual bite. Other is aggressive bite. And mostly third is most aggressive bite, which involves ear. And there's one, I don't remember the name of the boxer who did this most aggressive type of bite on the opponent. Then is Cormoran and Sims classification. This is basically on the agent by the causative person, human, or it is by the animal. Second is by the material. It's on the food stuff. It is on the skin or other material like wax or food stuff like apple, cheese. These type of bite marks are more evident. McDonald classified in 1907, it is based on the etiology, tooth pressure marks. Then there's a tongue pressure mark, which sufficiently amount of tissue is taken into the mouth and the tongue presses it against the rigid areas. Tooth scrape mark and the complex marks. This complex mark is combination of tooth marks, tongue marks, and tooth scrape marks. Then degree of impression could be hemorrhage and undamaging mark on the skin, abrasion, a scrape, contusion, that means ruptured blood vessels, laceration means punctured skin, incision means near punctured skin, avulsion means removal of the skin, and artifact means bitten off piece of a skin. Then there's one other clearly defined by definition, clearly, obviously defined, lacerated, that is skin violently torn from the body. Now this type of lacerated means the level of crime is much higher. And then is violent pressure is quite noticeable. This is sexually oriented, child abuse cases and self-inflicted bite. That is mental retarded persons, psychological disturbed people may also inflict bite on themselves. That is self-inflicted bite marks. Injury, identifying the injury as a bite mark. How do we identify whether this injury is a bite mark or by some other level of instrument or some other animal, or it's by human bite mark? So there are basically three different types of features. Gross features. Gross means grossly we look at whether it's a circular, elliptical, or a center. In this type of thing, the central area will be ecchymosed due to sucking action. Class feature means what type of shape the incisor has: rectangular, triangular, premolar, molar have a spherical shape, point shaped, and this depends of type of adhesion also. Individual means fractures, rotation, spacing between the teeth, or any extra tooth that is present, which is normally in individual person, not all person. These are the different type of class characteristic. Shape of the arch, tooth alignment, thickness, width, and if there is some missing teeth. Types of bite marks. Female usually are bitten on the abdomen, breast, thighs, buttock, and pubis. Men are on back arm, shoulder, chest, whereas self-defense normally on the hand and arms. Important thing, how to identify that and what are the factors that affect the bite marks. Site, which site it has, whether it's a loose tissue or a tight tissue. Curvature of the surface, dragging during bite process, like especially in rape cases, you'll find a lot of dragging during biting in defensive bite marks. Structure and vascularity of the tissue, time-dependent changes, environmental factors, and medication. So under factors affecting bite marks, type of tissues, loose or excessive fat tissue, bruising, this will have a poor definition, whereas fibrous, the definition will be good. Bruises will be less. Loose tissue, bruises will be more due to movement. Age, infant and old individual, bruises will be more. And in sex, female tend to bruise more than the males. And the bite mark is marked. This in female, it will be evident for longer period of time as compared to the male. This point has to be kept in mind. Then due to medical status, bleeding disturbances, anticoagulant therapy, person on anticoagulant therapy will bruise more. There will be more of blood, more bruising. Time. Depression would be in skin due to bite marks. And this type of depression normally recover within 10 to 20 minutes. Now this is one of the challenge. How much time the bite marks will be evident on the skin? 10 to 20 minutes. You can't call the police and you can't have that bite mark impression when there is a depression in the bite marks. So that will be taken after the swelling goes off, and then discoloration is another part. After death, it tends to contract, harden, and decompose. This is other time-related factor. Location, size, and shape of the bite mark is affected by its location. That means body bend, distortion. I'll show you a picture where you'll see two different bite marks. They are the same bite marks by the same set of teeth, but it looks of two different people once we change the location of the body. Clothing, most of the marks are through the clothing. Hence, clothing is considered a potential source of bite mark impression. And most importantly, clothing, you won't get a bite mark in clothing, but you'll get a biological evidence like saliva from the clothes. So this way, and poor photography is another important issue, which is a big challenge nowadays. Coming to the distortion, how does the distortion occur? There are two types of distortion. Dynamic distortion. Dynamic distortion means when the bite mark is happening, somebody is creating a bite mark and the other person is moving. So distortion will be another issue there. then there will be a tissue distortion. This is when at the time of occurring of bite marks. Second, be recorded on the particular form. Then the shape, it is round, oval. This is a clinical examination of the bite. Vertical direction, what type it is, as I classified in the classification part.
Neeraj, sorry to interrupt, but your screen is not visible.
1 second, ma'am.
The slide. Okay.
1 second. Is it visible now, ma'am?
No, not yet.
I need to reshare that?
Yeah, I think you just check it.
Yeah, I'll do it.
It's called Meenakshi. Yeah, now it is visible.
Now it is
visible. Yeah.
Right. I think I'm getting right. Okay. This part was done, ma'am, or should I repeat this? Description. Okay, I'll go with this. So while the description of the bite mark, we need to record the demographic, location, and the shape. These are very important. All this recording will help the forensic odontology while testifying in the court of law. And the color, size, and type. What type? Laceration is there, incision, aversion, what type of it is there. Then how do we collect it? Visual. We need to examine that victim, type of injury, contour, texture, physical appearance. All this has to be recorded. If it is victim is dead, then visual exam must be done before an autopsy. It should not be done after the autopsy. Before the patient is sent for a postmortem or the victim is sent for the postmortem, this has to be, pictures has to be taken just before the autopsy. Now, how do we take the picture? This is very important part. ABO-FO has issued a guideline and they have a scale called American Board of Forensic Odontology number 2 scale. I'll show you the picture and how that is important. This type of scale usually is kept alongside of the bite marks and photo is taken. Now, how do we take the photo? Photo has to be taken at 90-degree angle. Both the victim, that part of the body and the scale should be in the same plane, and then from top at 90-degree angulation, the photo has to be clicked. Serial photographs are to be taken, preferably with the film camera. And nowadays, we rarely use the film cameras, we are using digital camera. But in court of law, the negatives as well as the photograph of those negatives are usually considered as a log. So digital camera is rarely accepted because changes can be done in that digital image. Another important before taking the photograph is saliva swab. This saliva swab has to be collected from the site of the bite inflicted. This is ABFO scale. Now it has a marking on both the arms in centimeter, in millimeter. So this will help recording the size of the bite mark. The circle around is just to see that whether it has been kept in the same plane of the bite mark or not. If it is not kept on the same plane of the bite mark, then the circle will not be evident as circle in the picture. With the picture, you will click to analyze the bite mark, right? This is how it is taken. It has to be in the same plane, the bite marks as well as this. And you can keep a coin. If you don't have this scale, you can have a normal scale and keep a coin around side at this. Try to keep it at the same level. If the coin comes at round, exactly round near the picture, then it will be good picture and you can easily compare the bite marks, easily analyze the bite marks. Another scale which is from Zulo Emilio. Emilio is a very good friend of mine. And he and his team designed this scale, which is not available in the book. This is one of the article. This is calorimetric scale. Now, the important part of this scale is this is as good as a ABFO number 2 scale. It has given a color coded to the scale, both the arms of the scale. This color coded tells us how old the bite marks is. The exact age of the trauma can be defined with the help of this. If it is blue means 2 to 5 days, purple 2 to 5, another green is 5 to 7, yellow 7 to 10 days. So this might help in some cases. So these are the colors and given their cyan, magenta and yellow level readings of the colors. This is a journal from where this reference has been taken. This is visual aid for bruises. Method to preserve the bite mark evidence. Normally what do we do is we give a vinyl polysensor, we call it as soft putty, put it on the bite marks, put a gauze piece with slight pressure and put a dental acrylic or plaster behind that. You will be getting a good bite marks. This is the impression technique for taking and preserving the bite marks. Saliva swab, as I was talking, there's a double saliva swab technique. That means you first involves moisten the side with the swab with the sterile saline, and then remove the moisture with the second dry swab. Put both the swabs in the glass tube and send for analysis. This is called as double saliva. This gives you some sort of saliva evidence and you can get DNA from that. And this is the examination part. History has to be recorded, how it had happened. Normally what happens is police calls you to record the evidence. Then you have to take the history before recording the evidence. And then photograph has to be taken as explained. Other examination to be done, TMJ, muscles, opening mouth, everything. Any fracture, any intraoral finding has to be recorded. But this will help at the time of analysis of bite marks. Then saliva swab. Now comparing relationship of the jaw, dental charting of any missing teeth, all this class and individual recording characteristic has to be recorded. Now, very important part of the presentation, bite mark analysis. Now, this is the discovery and preservation. This includes discovery and preservation of the evidence and evaluation comparison of the finding. Bite mark analysis is not same as a bite mark comparison. Analysis means everything starting from the intraoral examination till the comparison part. Nothing but a patterned injury, circumstances surrounding as it is taken into consideration, frequently gives a valuable information that you need to testify in court of law. But interpretation of these findings is totally based on the experience, training and circumstances of the event. You have to take in consideration the circumstances, how it had happened. Well, I'll be sharing one case a detailed case history of a patient, and then you'll understand why these other circumstances of the event are important. Analysis is in bulk. Most important role is of forensic odontology, and the most important part of forensic odontology is to avoid this bias. It's a very crucial question to be considered while analysis. How it happened, who, what is the accused age, adult or a child, whether it was made through clothing, whether the swab for DNA was taken or not, whether the person bitten alive or when he was dead, when the victim was dead. So these are important parts. Whether even it's not a patterned injury, even whether where it is located, is it possible that this could be a self-inflicted or offensive or defensive? And in case of multiple bites, who did the bites? Who is the biter? Whether one person, 2 person, 3 person. Like in Nirbhaya case, they found bites by 7 people on her legs. I saw that photograph in one of my course. 5 people bite marks were there. 3 bite marks, 3 people were identified with the help of bite marks. Whether 2 bite marks could not be identified, could not be analyzed in a proper manner. How do we analyze that? There are more than 20 different methods to analyze the bite mark. One is comparing an acetate overlay. Acetate overlay is nothing but your OHP sheet, and you draw the bite marks with the help of study model, and then you compare that with the life-size photograph of the wound. You can compare the model with the life-size directly, or you can make a acetate overlay manually and then compare, put it over each other and all that. You can compare manually fabricated acetate overlay from the bites. You can compare acetate overlay from the X-ray. What do? Is we put a radiographic material, the radio opaque material on the wax bite and take. I'll show you the picture, then we'll come to know. And some otherly are hand traced from wax, hand traced from cast, computer-based, 3D scanning, xerographic. Nowadays, 3D scanning softwares are available and computer-based are being done. Manually, codes are not being accepting nowadays. There's one out. This is not used nowadays, but just to tell you, odontometry, we take distal most part of the canine, 2 points, and one in the center, the outermost center of the central incisor, any of the central incisor, the outermost. And when we see the angles on the bite marks as well as on the cast of the accused, and we compare those angles. This is a very simple manual method. Compare with vernier capable or with computer digitalization. These are also helpful. This is a pattern association. We know the pattern, how it is. These bite marks are not very evident here, but the pattern can be made out with this. Look at this picture. Direct method and indirect. Either you make an overlay or you put a cast over the bite mark. Or bite marks life size picture. This is a radiopaque. You tell the accused to bite it on the normal modeling wax, put a radiopaque material in that, take an X-ray, and then put this X-ray over the life size picture of the bite marks of on the accused body. And this is not very good method basically. This is a lot of manual work is involved in this. So this bite mark can be distorted. This is an overlay. This is hand trace method. You design on this OHP sheet and then put it on the cast. This is the most easiest method, but there are a lot of scope of errors in this. This is how we take an impression of the styrofoam wax plate, tell the patient to bite, and you record the bite on upper and the lower part. And then you see the distance between the molars and all that. Many things you can do it. The horizontal width and the vertical width. Powder method is not very famous and not yet explored in the bite mark infection. This is as good as a fingerprint. You put a fingerprint powder with a brush on the bite marks and then take the bite marks with the help of a sellotape. But not very much explored in the bite mark infection. This is the method which is normally explored in the bite mark analysis. This is left side. On the left side is a bite mark picture with the ABFO number 2 scale, this is a life size picture. Life size picture, in short, I tell you how to explain. Okay, you take a picture, that's a normal picture. You have to take it, make it through the computer, through the Adobe Photoshop or GIMP software to make it a life size. Life size means all the area of the pictures are same, in the same plane, like the circle, this thing, whether the measurements are exactly 5 centimeter on the pictures or not. On the scale, we know that is 5 centimeter. But when you click it at a close-up level, this 5 centimeter you compare with the scale will not be a 5 centimeter. It will definitely be more than that. And if you click at some height, say 2 feet, 3 feet, this 5 centimeter of the scale will not be a 5 centimeter on the picture. It will be less, right? So life size means to make this 5 centimeter into 5 centimeter, 1 millimeter into 1 millimeter, and this circle on the scales should be circle. So this is how the bite mark will be changed into a life size. You need to change the scale into the life size picture. I mean, you do all calculations and all computer graphics, not graphics, computer calculations on the scale. So automatically this bite mark will be converted into life size along with the scale. Then you can compare with the accused this thing. Unique features. Another thing that has come nowadays is 3D scan. Just scan the bite marks, scan the dental bridge, and the software will compare. This is a dental print software. This is how they do it. A picture. More scientific, more quantitative, easy to use, but highly costly. This cost is around, start from 10 lakh, goes till 18 lakhs. This is very less than deformability and elasticity of the human. These are the few problems. That doesn't mean the science is useless.
So, sorry, Neeraj, again the screen is not visible. You have to share it again.
I'm coming to that. I'm doing.
Yeah, sure.
Some network issue, I suppose.
Yeah.
It is come?
Yes. Continue.
Yeah. Movement of the skin. Skin is not a good recording medium. Healing power of the skin. Even the color of the skin. Then there's the elasticity of the skin. These add to the problem, but that doesn't mean this is not a good science. I personally feel this is a good science. Now look at this. Position. The bite marks are blue. The biter's overlay, the bite marks are black. The biter overlay are blue. It's taken from one of the article. The bite mark inflicted with the arm straight at this side. When arm is straight, this black bite marks were inflicted. But when you position the bite mark on other angle over the head, if you put the arm over the head or position the arm on the other angle, you see there's a distortion of the bite marks. See, the overlay is same, the blue is same, but the black part, there's a slight rotation of the central incisor. Here it is not very evident. Identification, and in court of law we used to the accused or the evidence of bite marks in this pattern. Positive means sufficient uniqueness is there.
Sorry, Neeraj, again to interrupt you, but again the screen has gone.
Yes, let's put 1 second. Okay, ma'am.
Yes, yes, you can.
Yeah. This is very important part, ma'am. The main challenge I wanted to talk about. These are the different type of identification, and we used to give in court of law the testimony in court of law basis on this type of identification. Now, what happened is there's one organization called Innocence Project. This is founded by Peter Neufeld and Barry Scheck in Cardozo School of Law. Their main idea was to give justice to the innocent people who have been convicted through the DNA testing and to reform the judicial system. This is in America, right, ma'am? So this is the organization who started talking about this science, basically. And there are around 34 cases who have people who have been convicted on the basis of bite marks, and this organization helped them to exonerate them, to take them out of jail after years of their conviction. How this happens? This is one Benny Stark case. The bite mark was a 1986 case. His sentence was 100